Hi, I'm Dr. Rovetti. Today we're going to talk about impairment ratings of the fingers. So, I've been doing impairment ratings for the last 20 years, and we'll show you a typical finger impairment rating. This one we have here is the ring finger, and it was a fracture, avulsion fracture, and you can see there's a little bit of impairment because you can't really straighten it out fully. So, with impairment ratings, there's four things we look for. First one, right off the bat, we see if there's any amputation, and you can see on this finger it's full. If there's any questions, it's the other hand. You can compare it to the other one. Sometimes you'll find just the tip of it's just off just a millimeter or two, but still that's a significant finding, and it will increase the impairment if you can just check the length. And what I usually do to find amputation, I take a measurement from the crease to the tip, and then we do it to the contralateral finger, and it should be exactly the same. If not, you can give some impairment for that. Second thing we look for is range of motion, and then the third thing we look for is either you can see this on top here, if it's a lateral deviation. Sometimes you'll have I find sometimes that the little finger will just kind of stick out like that, and it's really hard to keep it in. It just kind of keeps going. So that's a impairment of lateral. And sometimes you get it here, depends on where the injury, and now and then you get one here that just kind of bends. Sometimes you see a bend, but then you can look at the other finger and see if it's the same. And sometimes I get fooled and look like it's an impairment because it's bent, but then you look at the other finger and it's the same. And then there's also loss of sensation that we can test. There's two nerves that go up the finger, each finger. One's on the one side, one's on the other. It really splits almost perfectly in half the sensation of the finger. So we do test sensation on both sides of the finger. There's not much impairment for this part of the fingers, and you don't really use that much when you test trying to feel things. It's almost always on this side, so that's what we test for sensation. And then there's also a rotational deviation. Sometimes the finger will twist because of an injury to the joint, but again, you can compare it to both fingers, and you can see if that's really a rotational.